My name is Georgina Gethin and I'm from the National University of Ireland in Galway, and I'm also the Honorary Secretary of the European Wound Management Association. This document is for management of patients with venous leg ulcers, and it was done by EWMA in cooperation and collaboration with Wounds Australia. The aim of the document is to identify barriers and facilitators to the implementation of clinical practice guidelines in venous leg ulcer management, and also to provide clinicians with clinical practice statements arising out of guidelines that we have reviewed. It's really important to address this document from a few perspectives. One is that the number of people with venous leg ulceration is increasing all of the time, due in part to our ageing population and also the increased prevalence of comorbidities among patients. And the second reason it's also important is that through our search we have found upwards on 20 different clinical practice guidelines, but for the purpose of this document we reviewed 10 of them. So it was really important for us to help the clinician in understanding the areas of similarities between the guidelines, but also perhaps areas of uncertainty or differences. And in doing that, to help the frontline clinician who's often very busy, and this document would provide almost like a one-stop shop for them. So this document, as I say, was produced as a collaboration between Wounds Australia and EWMA. EWMA itself represents 35 different wound care organisations across Europe, and as an umbrella organisation, as a leading advocate in the promotion of evidence-based practice and in attempts to promote increase awareness of wound healing, this document was therefore vital for us to support frontline clinicians in identifying areas of uncertainty, but also in promotion of best practice and ultimately to try and improve patient outcomes. The target audience for this document are healthcare professionals working in all disciplines, working across all care settings and in all countries. Arising out of the document, we have identified recommendations for clinicians surrounding best practice in management of patients with venous leg ulceration. And these are clearly articulated in the document, but one of the, I suppose, primary recommendations is that assessment, comprehensive patient assessment, should be completed by healthcare professionals who are educated, trained and competent in that assessment. And through the development of an accurate diagnosis, this then can lead on to either referral forward to other specialties or through appropriate management of the individual patient. So this document can be downloaded free of charge from the EWMA website at www.ewma.org, and it has also been published by the Journal of Wound Care and is available through their site also.